think this is the most interesting panel or session that we have for the entire conference. We actually started off this patient roundtable last year. And when we did it last year, the focus was on health equity and different challenges that people or patients go through to take care of their foot ulcer and then prevent amputation. The focus this year is a little bit different. We want to learn the experience of, first, the different things, care management that our patient friend go through, and two, I think most of them now don't have active disease. So the ulcers heal for all of them, and they are managing their disease process as a long-term strategy. So we want to learn that perspective, as well as the interesting thing that they do, and we'll find out a little bit more. So I think we are really honored to have David, Brian, Jean, and Dan here to share their stories. And one of the patient partner that we have last year, Alex, actually passed away last year. I know you might or might not remember him, but so it is great for us to actually learn their experience. So I think we'll start off with a brief introduction. We'll go through from each of you guys, and we'll start off with you, David. So maybe tell us a little bit about yourself and yes, please.
Hello? Okay. Good afternoon. My name is David Galvan. I'm 51 years old, born and raised in Los Angeles, father of 6. 3 older children, 3 younger children. I've been diabetic since the age of 19. And at the age of 45, is when I started experiencing a lot of the effects of the disease. One of those being foot ulcers, and I do have an amputation on my right foot, and I'm also legally blind, but I'm happy to be here.
Thank you.
Good afternoon. I'm Brian Giesler. I'm been in the LA area since 2016. I was recently diagnosed back in November of last year as having achieved a 12.2 A1C, and got immediate attention of my doctor at USC Keck. And he said, "Is there anything else that you want me to look at?" And I said, "Well, I've got this thing on the bottom of my foot that just doesn't seem to want to heal." And he took a look at it. He said, "I'm going to get you an appointment with Dr. Armstrong." So I met Dr. Armstrong about 10 days later. He immediately recognized exactly what was going on. I had no idea that this even existed. I thought it was just something I'd stepped on and just didn't want to heal. And now I credit Dr. Armstrong and his team with saving my toe. And I fortunately have not had an amputation yet. And as you mentioned, it's in remission, but it is a long-term process. And so I also greatly appreciate every one of you and what you do in your communities with your patients.
Thank you. Jean, you're next. Yeah.
Hi, my name is Gene Hayes. I live in West Covina, not too far from here. I've been in the same neighborhood since I was a year old. I was told I was diabetic in 1995, so however long ago that was. I can beat his A1C score with a 12.6. It's been an interesting journey over those years. I can recall when I was first diagnosed telling a friend of mine on the phone that, at least it's diabetes, it's nothing serious. That couldn't be farthest from the truth. But there's been many times throughout those years where I was kind of in denial that I was diabetic and didn't follow all the rules and guidelines and things like that. And that's what got me to that 12.6 day just about 3 years ago. My wife had a different medical problem and was in the hospital for 4 days. And when she came home, I said, "Hey, take a look at this ouch on my foot kind of thing." And then I spent the next 4 days in the hospital. Probably a few months later, they amputated the small toe on my left foot, but it still wasn't healing very well. And I've kind of come to the conclusion pretty recently that I think a lot of that was just simply where the blood sugar was. And I had convinced the doctors over the years, or the wound care and the podiatrist, they'd ask, how's your blood sugar? It's okay. They never asked the specifics. And I think that's part of it is I think the doctors need to kind of make sure they're getting into the nitty gritty, and especially if they deal with a stubborn person like me. But I can happily say my A1C has been 6.4 all year this year, pretty even. I've got another little wound that's healing up very well. And I came to Dr. Armstrong by referral from a local podiatrist and wound care specialist in a community hospital near my home. And I think they'd probably been to a seminar like this before. They, at that time, it mostly needed to be finished healing, and it did. And the one thing I've told people about is the offloading that he put this boot on my foot and said, don't take it off for 6 weeks. And, you know, I'm so used to having been debrided every day or two and wound bandage changes and everything else. He took it off a few weeks later, and it was miraculous how it looked. And between that and the constant care of my companion lady sitting here in the front row, who constantly is watching what I'm doing, she won't let me get away with anything else bad anymore. So that's kind of my story right now.
Hi, my name is Dan Hughes, and my story is a little bit different than theirs. My jobs that I did is I was a fire paramedic in LA County. I was also a police officer in West Covina. So we found out just sitting here that we've been around each other, lived like almost in the same block for a long time, and probably went to the same hospital. But mine was that I went to probably the same hospital that he did, and my problem was, first of all, when I was working both my jobs, I had a massive heart attack when I was 40 years old and went into cardiac arrest 6 times. I was brought back by that hospital, but later on when we got into the wound care and all of that, it was a little bit different story. Now, I've had a metatarsal cut, which is half my left foot, and I went through a lot in the couple years that I had to deal with it. And finally, my doctor, my vascular surgeon that I had, told me one day, he goes, man, I don't know what I'm going to do with you. And I said, well, what's that mean? Am I going to die or what? And he goes, no, I just don't know where to go now. And he gave me a business card for Dr. Fred Weaver, Dr. Armstrong, Dr. David Armstrong. And I went there, and it's the best move I ever made in my entire life because they are on top of things. I haven't had any injuries lately because they take so good care of it, but I have a lot going on. And my A1C, I'll blow both of them out of the water. I wasn't always a diabetic. Mine just started recently. So I had the heart attack, then I had the amputation, then I got diabetes, and trying to control all of them, it's a nightmare. I've had like, I don't know, something like, maybe Dr. Armstrong knows better, but something like 25 to 30 surgeries over the last 4 years, including angioplasty, angiogram, all that other stuff. So my message is that one of the problems that I had was with doctors in smaller community hospitals, not that they're trying to hurt you, they're trying to do the best for you. But sometimes I know, being in the medical field as a paramedic, and I also started PA school in the 70s, but at that time there was no call for it. So I have a little bit of knowledge, not like these guys do, but sometimes they get to their scope in and they're not trying to hurt you purposely, but they don't know exactly what to do. And this is the message that I'm trying to get out to. When you feel that coming on and you're not exactly sure, there's always some place that you can turn to. The USCs, the other major hospitals, learning hospitals where there's residents and fellows, it's the perfect way to go. And so that's my message for this.
Thank you all for sharing your story. Sounds like everyone is in remission, so congratulations. And I think there are many things that we can learn from just the few things that everyone talked about. Obviously we are in LA County, not in Central Valley that Dr. Humphreys talked about that need telemedicine. Sounds like we still have challenges trying to get the care that we need to, serve the community. Perhaps we'll start with David. I know you talk about how the challenges with blindness that you have with, trying to recognize, identify that ulcer, your ulcer when they happen. Can you talk a little bit about it?
Well, actually, the ulcers came first. The issues that I had with well, no, I take that back. They're kind of concurrently, but I didn't lose my eyesight completely. It was just one eye at the time. So miraculously enough, I could function with just the one eye at the time. But the ulcers and the subsequent, issues with my legs and my feet, I think those were, believe it or not, a bit more challenging than the issues with the blindness.
What do you do now with your foot examination?
Oh, I visit my doctor, I think every three to 6 months. Dr. Shin, I saw her earlier. I'm not sure where she's at. So, yeah, constantly go and they do a checkup on my feet, and everything's been going well.
Is there anyone at home that helps you look at your foot or feet?
My wife. My wife will help me. She kind of glances over from time to time, make sure there's no wounds or that I'm not walking around barefoot or stuff of that nature. She makes sure that there's no hazards around the house that could potentially injure me.
Yeah, it sounds like wife play a significant role. I think Mrs. Hayes is in the audience, sitting in front. So thank you for coming, and thank you for taking care of Jean for us. Yeah. And we'll go to Brian.
Okay.
How come your sugar level went up to 12?
Well, I have since discovered sugar is in everything. I love skim milk, and I figure, well, skim milk, that's got to be good, real low in fat, got to be healthy. Wrong answer. You all know skim milk, like all milk, is just loaded with sugar, and I used to love to drink a lot of skim milk. And so, I learned a heck of a lot about A1C, and since November, my A1C is now down to 6.5. And my Dr. Karp, who's my primary doctor, he's absolutely delighted, and Dr. Armstrong is as well. And my wife and my kids, who are both grown adults, they are the ones that have been incredibly supportive through this whole thing. And my wife says, this has got to be healthy for all of us. Let's just cut out sugar. And so she's coming up with all these recipes that use zero sugar ingredients and looking for all the organic flours and everything else. And they're just incredibly supportive and helpful through the whole thing. And with regards to foot care, I'm paying a lot of attention to my feet and also to what I eat. And in the last 6 months, I've probably lost about 35 pounds as well. And so I'm keeping the clothing stores in business. But anyway, it's a journey. It's going to be a lifelong journey, and I give lots of credit to everybody in my support system, and certainly hats off to the spouses and the family that helps all of us.
Jean, I know you are still working, and we talk a little bit about this, and there are some challenges that you need to overcome to get appropriate offloading shoes, for example, and there are challenges that you need to overcome when you're working. Can you tell us a little bit about that?
Well, it's interesting because my work in the last 3 years, which coincides with how long I've had these major problems, is evaporated because of a pandemic. For a long time, I would travel 2 or 3 weeks out of a month as an auditor for a commercial finance company, going to wherever our borrowers were. And so I got some exercise, I got around, but in the last couple of years, there's been hardly any travel. I think I've only been on an airplane 3 or 4 times this year, and it's almost the end of the year. but and so that inactivity is a constant struggle, and I get stiff from sitting and things like that. And so I try to get out and walk with my wife once in a while, sometimes with our crazy little dog. But it is a major challenge. And I too, I feel like I'm at Alcoholics Anonymous here. or his comment about milk. I mean, a gallon a day sometimes, well, half a gallon a day sometimes, and pasta. When I was young, my father was diagnosed with a heart problem about the time I was in high school. Took a medical retirement because of it, and so he was always having us eat pasta and all these things that were low in the fats that are in the meats, and so pasta is one of the worst things out there. It's just like everything else, but everything I'm learning everything in moderate proportions, because even the sugar alternative things aren't so good for you. The other bad habit I had was Diet Pepsi, and I've mostly stay off of that nowadays too. So.
Thank you. And Dan, I think I think you mentioned some of the challenges for getting to the right doctor, such as Dr. Weaver and Dr. Armstrong. What can we do differently? What can the system do differently? You know, obviously you have great commercial insurance, so the insurance is not an issue. It sounds like it's more the process of care that we are not doing the right thing.
Yeah, I think that there's a lot to it. But before I go any further, I better introduce my wife. Lisa's here in the back too, because after Gene's wife got introduced, I'd be in trouble after I left here because I didn't say anything. But and going back to a little bit on Gene's question on working, you know, I continue to stay busy right now. One of the other things, I've been an elected official in Riverside County for 23 years, so I get to speak a lot and get to do things, and my title is chairman, but mine are on all, my job is all in quality of life. So the things that I've taken on is like Dr. Armstrong asked me if I would be on the limb preservation thing, because I think that there's a lot, not only in LA County, but all the other counties need this. And I've already started the process of working with other docs and ERs and the head of hospitals to get this out, because I know that this is a major problem, specifically in LA County, I heard, because we also work with Casa Colina Hospital, that there's a lot of amputations, and sometimes those amputations are done and they don't necessarily have to be done at the time that they want to do them. That's like the first thing that they do is they want to amputate. And so the collaboration that I've heard here a lot is a big thing that we need to do. The collaboration and working together with resources that we all have to promote what's in the best interests of the patient, period. And that needs to happen a lot more than it's happening. I mean, I could go on for 3 or 4 hours what I went through, 2 years in a hyperbaric chamber, 5 days a week, 2 hours a day, and there was never anything done. I mean, and I appreciate the doctors that I have, and I don't hold any grudges against them. It's just that we can do better than that. And if we all work together, it's the same thing I do in my elected position. If we all work together and utilize our resources that we have along with others and work together, we can do some pretty fantastic things. And that's where we're headed.
I have a burning question. Something that I'm always very interested in is communication with my patients. Nobody is 100% honest with their doctor, but when it comes to diabetic foot issues, it's serious and it can result in you losing your foot. What are some of the reasons that you may not be completely truthful with your doctor, and what can we as practitioners do to improve it so that you are going to be more forthright with us?
I think one of the biggest things, because we don't want to go through what we have to go through. I mean, we know it's a problem, but let's face it, you don't want to go through. But I think one of the answers to that, and I've talked to Dr. Armstrong about this before, there should be some kind of program, or maybe we could incorporate, I know you have HIPAA things that go on, but how about patient to patient? people that have actually experienced this, because nobody ever told me really what I was going to go through. I mean, you hear amputation, okay, that's great. I'm going to have an amputation, but what's going to happen? What's the process before and what's the process after? How do you recover from this? And I never really had those answers. One of the biggest things that I had a problem with was I was in pain management. Now, you got to remember, I was a paramedic fireman, so I knew what the medications, the morphines, the Oxycontin, the fentanyl, all of that, nobody ever gave me, and I questioned it. Why did I never get Narcan? Not for me, but for my family, because even knowing what I knew, there were times I had a situation that I was in a lot of pain, and I had taken a morphine, and then 20 minutes later, I told my son, well, it's been like 5 hours since I had the last one. And he goes, no, Dad, it's been like 20 minutes. And I argued with him, said, no, it's been like 5 hours. So even though you know what the consequences are, sometimes you lose what you're doing when you're on those medications and you've been through a traumatic experience. So that's one thing.
I would maybe add to that the doctors, first of all, when I first had a situation come up, the podiatrist I was seeing at the time never sent me to any wound care. And one time when I ended up in a hospital because of the situation, they said something about going to wound care. I said, what's that? I had never even heard of it yet at the time, and that was 7 or 8 years ago now. And then so I got in with the wound care. The wound care and the podiatrist, those were two of the best doctors I ever had in my life. I really enjoyed them. And it was finally when they actually referred me to Dr. Armstrong, and I was like, wow, this is really amazing. But I think part of what could have kept me out of some of that trouble is if the podiatry and wound care people communicate and with your primary doctors, you know, kind of understand where your lab results are, or simply ask to see them. Maybe they don't call the other doctor, at least, you know, get me a copy of it or information like that to keep people like me honest, because I wasn't honest in that category. In terms of my auditing, that was different.
You ask about communication, and I think it's being honest with your doctor starts with being honest with yourself. And you know, I'm the CFO of a large nonprofit organization here in LA County that does work throughout California and even some programs across the U.S. And we're focused on everything related to public health, population health. And you know, so with the programs that we operate, everything, you know, we cover the full spectrum of the social determinants of population health. And so I understand the value of communication and being honest with your doctor, because they're in the best position to help. And if they don't know, you know, they're not necessarily going to stumble across it and say, hey, what's that? We need to run some tests. And time is not your friend here. And you know, so after I had that first meeting with Dr. Karp, and he took a look at it, and he said, I'm giving you the referral to Dr. Armstrong. In the patient portal at USC, which is part of the communication that I got back, I saw all the notes that Dr. Karp put in there. I saw all the notes that Dr. Armstrong put in there. And there was one word that just reached out and grabbed me, and really I sat up straight in my chair when I read gangrene. And because I know what gangrene is, and I know it's not good. And so I just, at that point, it just all became real for me. And whatever I was told to do, I said, I'm changing my lifestyle. I am changing everything I need to change in order to get control of this again and get on with life and not have to go down this other path that it seemed I was currently on. I needed to get off that path and get back to living a healthy life.
And David, we'll go to David first and then Dr. Humphreys.
Sure. So if I understand the question is how can we improve communications between the patient and the doctor so that the patient's more truthful to the doctor as far as what they're feeling, what's really going on? Okay. Take your wife with you. No, and I say that because 3 days prior to my amputation, I was going to go on a work trip, an international trip, and my wife kept telling me, "You cannot go." And I said, "Yeah, it's not a big deal. I've traveled with wounds before." And if it wasn't for her insistence, I may not be here, because it was extremely severe, the infection I had, and I was just more focused on my responsibilities to the family, to my employer, to everyone else, except the responsibility I had to myself. And once that changed, I was completely and 100% truthful and honest with my doctors. So that was my experience.
Patient or doctor, we should always listen to our wife. But Dr. Humphreys.
Of course you should always listen to a woman. So, I hear what you're saying about the communication, and we work in these fragmented systems where the podiatrist is at Keck and then the vascular surgeon is at UCLA or however it may be in different areas. And I think patients want communication to be easier in between all of those physicians. I kind of want to know how you see us doing that, because I don't think that the healthcare system is going to do it. I think physicians want to help and they want to be there, but the physicians are now in this corporatization of medicine where our time and everything is taken away and put into little buckets of widgets. And so is there a way for patients to come together and push this in a certain way? What format would it look like where everybody is communicating? Because I would love that, but it can't happen a lot of times. You can't find people these days.
For me, I would hope that happens, and that's what I'm trying to do out in Riverside County and such, is put the doctors together and talk about my experiences that I had out here. From the bad, well, I shouldn't really say bad, but it was not the right treatment at the time, to come into USC and getting the right treatment 100% of the time and trying to promote that to back to the hospital that I went to. I'll tell you a quick story on that. When I went back to my wound care in probably the same hospital that he was at, they asked me, "Who's your doctors now?" And I said, "Well, I have Dr. Armstrong." He goes, "Who?" I said, "Dr. Armstrong." He goes, "Are you kidding me?" And I said, "No, why?" And he goes, "I've read all of his peer-reported papers and all that. That guy is somebody I want to meet. Do you know him?" I said, "Yeah, I know him. I got his phone number. Can you introduce him to me?" I said, "I'd be glad to try to set that up." So I called Dr. Armstrong, and he can attest to this. He brought his whole team from that hospital in wound care out to see what they were doing here. And I know for a fact right now that they've initiated some of that wound care that they learned at USC back in this small hospital. So that's a help. It's just the communication and the collaboration and working with these other doctors to see, to tell them what one is like and what they should be like. They all want it too. They just don't know how to go about it. So it's going to take some of us that are patients, that are doctors, that I know your time is you don't have a lot of it, but that's what I'm trying to work on, is get them to understand there is a better way than what we're going. We just need to figure it out. We need to collaborate, sit down, figure this out, and get it out there.
If I might, just for one second, adding on to what has been said, and hopefully this will be helpful for all of you as well, is that I recognize that the appointment time can be limited based on all the issues that everybody is well aware of. However, technology has advanced. And so now we have patient portals, now we have email, now we have text messaging, now we have phone numbers to call the doctors and leave a message. And I've been absolutely amazed at how quickly I hear back when I send a text or I send an email or I make a phone call, leave a message. So that's another way of getting timely information, which is so important to each of you as you're treating your patients. But most importantly, the information coming back is so important to each of us, because it helps us work together with you to come and develop a great outcome for all of us and our spouses and families.
He was reading my mind with that comment, because I tell people constantly about how I can send an email to Dr. Armstrong and get an answer in 15 minutes. And that includes on a Saturday night when I'm in the ER with my wife with a completely unrelated problem, and he gives me the name of a different specialist at Keck because the local hospital couldn't deal with it. And they transferred her by ambulance the next morning, and she had surgery within 90 minutes of getting to Keck, all because of Dr. Armstrong. And it was just amazing. And that was a Sunday morning. So this was a weekend, a Saturday night. I mean, to be able to have that kind of communication, I can remember a different doctor some years back trying to just get through to him on the phone, get him to respond to a message through a secretary. But to have that personal, direct to the source connection is extremely valuable in more ways than you could ever imagine.
I think
One quick thing, can we just go back to the other doctors that support Dr. Armstrong? Dr. Shin, I've seen her many times, and she's the same way. I mean, you know, it's the personal touch that when you go in there, you're so happy that when you go in there and you got to see a doctor, and if you're seeing Dr. Armstrong, well, if I see Dr. Shin in there, she comes right up to me 100% of the time. That's what you need in healthcare, is that the patient has a want also, that they need some of these things too. And so their entire team is put together with people that, and I'll say it again, do what's in the best interest of the patient, period.
I think we'll go to David for last comment. Anything that you want to tell us before we go to the question on the floor? And obviously, our standard is Dr. Armstrong, whose reaction time is less than 1 second. So I don't think that is that should be the standard. But having said that, a dedicated team for sure, I think, will help with patient care.
Well, you know, my experience when I came to USC Keck was pretty much what everyone else here is saying. It was a team of doctors that came into the room. They brought in a vascular surgeon, I believe Dr. Armstrong, Dr. Shin, Dr. Khan, they were all in there. And the I guess the level of attention that they gave me and the issues I hadn't experienced anywhere else. So I would have to agree with, you know, the I guess that humanity that they demonstrate to the patient helps a lot.
Question from the floor?
First of all, I want to thank you all for being here and your willingness to share, and your wives to be here, as well as your support system. So diabetes is a disease of denial. We really don't pay attention to it until there's an outward manifestation. So we kind of trick ourselves too, like it's okay. But I was very curious about the word remission. All of you used it in sharing your experience about your wounds and where you are in your levels of amputations and your experience with your wounds. You related to it as being in remission. I love that expression because it means that you know that there's another opportunity that this could happen again. Can you share about that and where you learned to use that word, remission? I think that's something that we should take back. I use it with my patients, but I think it's very powerful. We hear it in the cancer and oncology world all the time, but I think that there's ownership and power in that. So could you share some of your ideas around that?
For me, it's I didn't use the word, but it is a good word. I think mine is because I'm every month I see Dr. Armstrong to make sure, and then between my wife and my son, who did predominantly most of my wound care when I was going through it and did a really good job at it, between them, they tell me if there's one little thing that goes wrong, and then they're calling Dr. Armstrong or somebody, Dr. Weaver, to find out where we go from now. So I think that the level of care, I see him every month or two, so, and that's the first thing he does. Look, he's right about the 1 second thing because he comes in and he's going a mile a minute the whole time, you know. So you get a few minutes with him, he checks you out, does his thing, and then off he goes to the next one. But for me, it's a great way to keep check on. I try to do that, but I don't think that. I think maybe some of that denial still plays in because I think I've gone through all this other stuff. I'll get through this too.
Yeah, I use the word remission, and I think it was used by others as well. But I believe, having been recently diagnosed with diabetes, I became a voracious reader. I'm not a medical professional, but I was, even started reading through a lot of the papers that Dr. Armstrong had published and that others had published about this. And I truly believe that this is a lifelong fight that I'm going to have for the rest of my life. And so, even though when my first ulcer healed rather quickly, and Dr. Armstrong said, "You must be part salamander." Anyway, he also said, this is a really good thing, but this isn't the end. And sometime in the next 30 to 40 years, this could happen again, and it could be worse. So you got to stay diligent, and you got to keep looking at your feet and taking care of yourself. And every day, the decisions you make will have a direct impact on what the rest of your life will be like. And so I'm a believer. And it's a monkey song too. Anyway, and so I think that's really the reason why I use that term, because this is something that I know you can't sue for peace. It's going to keep going.
So last two questions.
I actually don't have a question since the Central Valley was mentioned, so I want to come and speak with you guys. I would like to see a show of hands who know about PACE program. Who knows what is PACE? So PACE is program of all-inclusive care. I don't see 7-minute patients. I see 2-hour patient. I sit down with them and talk about their diet. I actually check their Freestyle Libre myself, not my nurses. So check that program. We change our patients' light bulbs, and we send them to UCSF in our van. That's a program we all need to be searching for, looking for, and if our patients need that, we need to give them that access. If we know about it, that's how we're gonna use that knowledge to educate them about it. I think everyone should look into PACE.
Thank you. And last question.
Just like to second what she says. I'm a simple vascular surgeon, and the physicians that I work with in the PACE program in North Carolina do a phenomenal job. And honestly, all of us should have health care like that, and it's a little sad in such a resource-rich country that we don't all get that kind of medical attention. And I think that Dr. Armstrong and his team have tried to emulate a lot of that comprehensive, human-centered care. But that is what PACE is about, and so you really should figure out who your PACE providers are in the states that you live in. I just wanted to second that, and thank you so much for doing that hard work.
I think my question is kind of related to the fact that a lot of people don't have that much time with their providers. Obviously, there's a lot of information that we want to share with you guys about diet and activity and what you should be doing at home, but the visits are short. So for your experience, what do you think would be more beneficial for a provider to set up for you? Do you think it would be helpful to get pamphlets that you can take home and read through them when you have time with your family? Do you think it'd be helpful to have like educational sessions that you can come to the clinic setting and there's like an hour long where we talk about these are the foods you should try to focus on or avoid, and these are the activities you could do? Like, what would be impactful for your life but not be burdensome?
Yeah, I'll start. I think everybody learns differently, and I think some people are visual learners like me, and others, learn in other ways. I love paper because humans are tactile beings. My wife hates it. And so I think one of the things that I found was very helpful was getting back to the USC portal, again, the patient portal, because there was a whole battery of tests that were run on me, and nobody who's not in the medical profession is going to know what every reading means and what the test is meant to tell them. And so, but you go on the portal and there's all these links, and you can dive down into them, and you can read pages and pages and pages about that test and about why these measures, like why is a 12.2 A1C really bad, versus, well, 6.5, you're on the road, to getting closer to where you need to be. And learning more about that, and that gave me the opportunity to do that on my time, on my schedule, given that my schedule is planned out by a lot of others, just as the nature of the work that I do. So a lot of my reading would happen, late at night or very early in the morning, and so for me that's what worked best. But others, have different preferences, and I'd say just use the technology in whatever works best for the patient.
And how about for you, David?
My experience, or the time that I have with my current doctors, I think it's always been adequate. But again, in my experience, it's the aftercare where I think there should be a little bit more attention or time given, like in the physical therapy, trying to recover from, let's say, an amputation or the drop foot situation. Sometimes an hour a week with a physical therapist, and then you given some pamphlet instructions to go home and do it. It's just not enough because there's no motivation. For a lot of people, speaking to myself, you got to go home, you got to deal with life, you got to deal with the family, and most of the time, the only time I would do the physical therapy exercises was that 1 hour when I would be at the office. So I think that coaching, for the patient, for aftercare, and more time, at the office would probably benefit those that are in the recovery stage of whatever they're going through.
Last comment from Jean and Dan before we wrap up.
Probably the best thing that could have happened over all those years for me was if you would have hit me with a 2x4, because I had very stubbornness. I kept denying it no matter what you want to say, and I'm not sure that anything could have gotten through to me to answer that question. I will say I find a lot of value in sitting here and talking about it. And, and I had been doing some mental thinking about what kinds of things I might want to say while I was here, and that helped too. But the peer pressure that you're not alone in those kinds of things, I think that that can go a long way too, because I'm sure at some time somebody said take this nutrition class or do this or be careful or you'll go blind or be careful or you lose a limb or something like that, but it just doesn't register sometimes. And I, like I said, other than short of a 2x4, I'm not sure what could have made it register on me. That might not have worked either.
I think it's a combination of all the things that you said, but I think the most important point is what Gene said, that when we actually feel like we're a part of what's going on, like today, where you get to talk about it and you're around people that are listening to you to try, that have a like interest of changing and making it better, it's worth the time. And when you feel like you're a part of the change that's going on, it resonates a lot more than getting the paperwork and all that stuff. Because I know for me, if my wife wasn't here, I'd tell you a different story. But when I take that stuff home, I may read a paragraph or two of it or go through it real quick, and then I'm done with it. But when you actually get into something like this, where you're actually active in the way things are going, it means a lot. It really does.
Thank you guys so much.
I think we can go on forever, but I think we should wrap up, or else I'll get into trouble. But thank you all for coming and sharing your experience.